Payment delays by the health department to companies supplying medical technology to provincial hospitals have led to mounting severe financial strain as well as debt. In some cases, the risk of business closure. According to the South African Medical Technology Industry Association, more than 1 billion rand is owed to 50 of its member companies, with over half of that amount outstanding for more than 120 days. I'm now joined by Scott de Oliveira, who's the chairman of the board of SA Medical Technology Industry Association. Scott, good afternoon, and thank you very much for joining us today.
Good afternoon, and good afternoon to your viewers.
I mean, being owed a reported 700 million rand by the Gauteng Department of Health alone, and that debt being set to balloon to some 1.4 billion rand. You say that some 50 of your member companies are affected by that. Tell us about the extent to which it affects these member companies.
The effect is quite significant. Our member base ranges from small to medium enterprises right the way through to large-scale multinationals. And specifically the small to medium enterprises, we are seeing them having to take out bridging finance, secure overdraft facilities, just to make payroll at the end of the month and to declare some semblance of business solvency. On a multinational level, it certainly brings into question the viability of maintaining a subsidiary within the country. So the net effect both on small to medium enterprise and multinational is significant. And if there isn't a drastic turnaround in the way in which the department is addressing this crisis, it will result in organizations foreclosing and job losses across the country.
And I would imagine, Scott, that the cost of credit now compared to a couple of years ago is quite significant. Talk to us then about, the cost of credit now and how government-induced debt is affecting these companies. You say that they could risk a foreclosure, but what other means are they also employing to maintain operations?
Well, a lot of them are sourcing their own financial resources. Effectively, government unfortunately hasn't been very forthcoming with regard to engagement and meaningful engagement. We are obviously seeing some payment processes being facilitated, but by and large, it's not addressing the crisis that we're currently seeing. As I mentioned, effectively 700 million is owed to our member base just within Gauteng. We've engaged quite extensively with the department, and unfortunately, it hasn't been met with any form of further and or action items that can be bankable. We have engaged with our members, and in our recent poll, 38% of our members have ceased supply to government institutions across Gauteng, and 48% indicated that unless there is a drastic change in the forthcoming weeks, they will see supply as well.
And Scott, what's the impact to the medical industry? I mean, what kind of supplies are we talking about that can be affected, these medical supplies that are at high risk of disruption?
It's a great question. So the medical technology sector ranges from a simple needle right the way through to a high-end MRI scanner and everything in between. In essence, to give you an idea, a hospital cannot function without the supply of medical technology. So the extent to which this payment crisis will have a drastic and lasting impact on the healthcare sector is significant. It will mean that patient care will be compromised. Hospitals and doctors will not be able to facilitate the needs of their patients that are coming through their respective doors. And obviously, on an industry base, it cripples what is already a challenged economy.
I mean, those are quite dire consequences for ordinary South Africans, seeing as the public healthcare system is already quite strained. What alternatives are you looking to?
Well, we remain, as SAMED and our members, we remain willing and eager to support government in resolving this issue. Now is the time for South African heroes and leaders to step up, so to speak, and take accountability at department level. And we remain committed to this process. One of the reasons why we're embarking on quite a robust public relations campaign is to highlight the challenges that we are seeing within the medtech sector. We're about to embark on the G20 summit, and we're calling on the leaders that will be attending the summit to really hold government to account and ask the tough questions around maladministration and corruption. Now, if you look at the figures that were included in a number of the media highlights regarding the challenges associated to Tembisa, that figure was about approximately 2 billion in misappropriated funds from the Tembisa institution. That would have covered the entire debt that is owed to SAMED members. And as such, and again, I want to clarify, these are bona fide medical supplies that are often life-saving devices and instruments. This is not, designer jeans and or fast cars. So we're asking leaders that are attending to this G20 summit to really hold government to account, ask the tough questions on how government, and specifically Gauteng government, is trying to support rather than undermine essential industries such as healthcare.
Scott, the NHI comes to mind. It's really seeking to centralize the procurement of such technology for the medical healthcare sector, right? Do you have any confidence then in the management of these funds if NHI does come to pass?
Well, we're concerned. We're obviously monitoring quite closely the various different court cases that have been levied. As SAMED as an institution, we're all in favor of universal healthcare and providing good clinical outcomes to patients and making sure that the average South African has access to good healthcare systems. However, we certainly are concerned around how the fund will be administered, taking into consideration the challenges that we've seen with the likes of Tembisa, with the likes of Tom at Helen Joseph last year. We're concerned around the maladministration and indeed the corruption that may spill over into NHI. The current situation doesn't give us a lot of confidence. The trust relationship between the Department of Health and suppliers has broken down. And as I said earlier, we really need sound leadership to step in and take hold of what is a very grim and dire situation. As I mentioned, our members, and in fact SAMED, are willing and eager to step in and look at how we can facilitate a payment process and payment plans that will address the current crisis. But we require a plan that is, one, published, two, that contains deliverable dates and action items, and again, that is published in the public domain so that the general citizen within South Africa can see what government is committing to, and that we can hopefully stave off any furthering of this potential crisis and ensure that the constitutional right of every South African to access healthcare is maintained.
How reluctant are your member companies to invest in potentially a new state tender process? And what will the implications of a reduced medical supplies pool be for ordinary South Africans?
So there's a two-folded question in there, and I'll deal with the member question first and foremost. There's a significant reluctance. As I mentioned earlier, in a recent poll, 38% of our members have already stepped back from supplying government institutions, and I'm talking specifically Gauteng, with a further 45% indicating that they will stop supply in the coming weeks unless this debt crisis is resolved. So that trust is certainly not there, and we've got a long way to mend those bridges. In terms of the impact on the average South African that is attending to government, state entities across the board, the situation is dire. Without the availability of medical technology, the ability to have healthcare professionals provide decent patient care is just not a foreseeable goal unless this crisis is addressed.
That was Scott de Oliveira of the South African medical technology industry.